Unlike some folks who have to live in the West End, I chose to live in the West End. The reason that I got involved with CAB is because I love my community.
As someone who majored in public health, I see the importance of vaccines. I know for a lot of people, they think public health is just healthcare, but it's actually involving the community.
I think the main thing is education. There's a lot of misconceptions. There's a lot of conspiracy theories. Also, you have a lot of people in this community who don't have a relationship with their healthcare professional.
I'm hoping that we can let people know that, your health comes first and that there are people there who care about you and want to fight for your benefit.
Go to the website. We got tons of information for you.
Vaccines, going to the doctor, these things are for their benefit. And I just want to advocate for them to let them know, hey, I'm always on your side. You have someone that's willing to speak out for you if you feel like you don't have anyone in your corner.
Welcome, everybody. My name is Adriana Bradham, and I am your host of CAD's podcast today. We will be talking a little bit about health information and educating you today about health concerns in the community. I would first like to introduce our guest.
My name is Dr. Crystal Narcisse, and I specialize in internal medicine and pediatrics, and I joined Norton Healthcare in 2017.
So our trending topic today, we're going to talk about vaccinations and why it's such an issue trying to get people in the minority communities to get vaccinated. So to start off, can you talk a little bit about the history of vaccinations and why there's a mistrust in minorities getting vaccinated?
Vaccines have been around for a very, very long time. And I think that mistrust in the minority population started back during the Tuskegee Project. It was a project that came about in 1932 and it ended in 1972, where the Center for Disease Control did an experiment to see the progression of syphilis, what it would do when someone would get it and how it would progress. Well, during the experiment, there were several people that died, but the thing that made a lot of people uncomfortable about it was because the invention of penicillin. Penicillin had been known since the 1940s to actually kill a lot of different bacteria, including the one that killed syphilis. And so because the project kept on going on, even though there was a known treatment, a lot of people became very distrustful of vaccines and healthcare in general.
So would you say, in your expert opinion, that people have a valid reason to have a little bit of concern when getting vaccinated? And what would you say to those who are concerned in order to get them on board to possibly get vaccinated every year?
I always want to validate someone's concerns. And of course, as a medical professional, I'm going to ask you to do something that I myself am going to do too. And I think that in order for all of us to be healthy, we have to vaccinate. So for example, if you think about what vaccines do, well, what is injected is either a protein or a piece of a protein or something that mimics it, something that mimics either a bacteria or a virus. And what we're asking for the immune system to do is to recognize it. So the first time you see it, you might not know what to do, but the second time you see it, your body can actually start to produce more antibodies in order to kill the bacteria or the virus. So for example, this is an example I like to give a lot of my patients who are a little hesitant about getting vaccines. The first time someone comes to break into your house, you might not know that they're coming. You're not prepared at all. However, the second time someone comes to break into your house, let's say they try to break in the same way, you're going to be ready. You're going to have your shotgun, a slingshot, whatever, in order to prevent them from coming into your house. And that's kind of what vaccines do. We inject something foreign, we're introducing something foreign into the body so that the immune system can recognize it and develop an antibody. Next, when you are exposed to a virus, whether it could be the flu or COVID or a bacteria, your body can recognize and say, hey, I know what this is, and I can get the entire immune system to go ahead and fight so that the person doesn't get sick.
Okay. And so now that we know a little bit more about the vaccinations, can you express or explain some of the misconceptions or myths that may be going around about vaccinations that a lot of people hear of?
Sure. The number one thing I hear is about the flu vaccine. Doc, I am not going to get the flu vaccine because the last time I got it, I got sick. And I can assure you that you will not get the flu from the flu vaccine because what is being injected is an inactivated piece of the virus. And so what people actually feel is the immune system reacting, and you can actually feel like you have the flu, but it's actually not the flu. That's the first thing I hear a lot of. The second thing is, Doc, I don't want to be treated like a guinea pig. And people, a lot of my patients will go back and say, Tuskegee, you remember Tuskegee, right? And what I say is, listen, no one is trying to experiment on anyone. We're trying to make sure that we keep you healthy and we keep your family and the community healthy. And so vaccines are very, very important. So every year, without fail, I make sure I get my flu vaccine because I want to make sure I can do my job in taking care of my patients.
Yes, ma'am. And can you also go a little bit into detail about the common vaccinations that the average American should get?
Oh, sure. It really depends on age. So infants, we have a schedule that we use that the Center for Disease Control puts out. So when you're born, you get the hepatitis B vaccine. And then after that, you get a series of vaccines for hepatitis B, diphtheria, tetanus, pertussis, Haemophilus influenzae, pneumonia, rotavirus, there's a whole list. And then around age 1, you get the measles, mumps, and rubella vaccine. And if I can just pause right there, because there's a lot of misconceptions about that. Many years ago, there was a study that came out that says that the measles, mumps, rubella vaccine gives people autism. And several studies, time and time again, have proven that that is not true. The measles, mumps, rubella vaccine is incredibly important to the health of our community. And right now, there is an outbreak of measles. Why? Because there are certain people in our community that are not getting vaccinated. So I think we have to kind of break this up into for kids and what we do for adults. So for kids, we have something called an immunization schedule that the Center for Disease Control puts out, and it lets us know what vaccines a child should have and at what age. Then for adults, there are some vaccines that you have to get boosters for. So one of them is the Tdap, or the tetanus, diphtheria, and pertussis. Pertussis, a lot of people don't know what that is. It's actually whooping cough, and you should get that every 10 years. And when you're about 50 years old, you should get the shingles vaccine. The shingles vaccine helps prevent shingles. So when you get chicken pox, the virus stays inside of you, and it normally lays dormant for most of your life. But if you get sick or if you get stressed, the virus can become reactivated and can cause a pretty painful rash. Let me tell you, shingles pain is not a pain you don't want to have. So when you're 50 years old, you would get the first vaccine, and then you would get the second shot about 2 to 4 months after that. When you are 65 years old, you get a vaccine called Prevnar. And what it does is it helps prevent you from getting 20 different strains of the pneumonia bacteria. So in between there's some other vaccines that you can get. So the Prevnar vaccine is also offered a little earlier than 65 years old if you have certain health conditions that make you more prone to getting sick from pneumonia.
Yes, ma'am. And so as you can hear from a healthcare professional, vaccines are very important to get. It's very important to ask your doctor about this, but can you also describe or explain where, especially the minority community, can go to get more educated on vaccinations?
The place that you should go to get your information about what vaccines are going to be best for you is going to be your primary care physician. Why? Because your primary care physician knows you, and they're going to know which vaccines are going to be best for your health.
And so one last thing before we close out the segment, what would you say to those who have high health issues, or those people who have a lot of health issues that they're dealing with? Would you recommend that they get vaccinated?
Absolutely, 100% yes. Unfortunately, when you have chronic conditions, it makes you at a high risk for death. When you have chronic health conditions, it does increase the risk of you getting pretty sick if you were exposed to the flu or COVID or anything like that.
So as you know, for those who are more at risk or have higher health issues, it's very important for you to get vaccinated because it prevents you from becoming more sicker from those diseases that are out there. So we naturally are exposed to diseases and germs. However, those who have more health risk or maybe lower immune systems, they can really benefit from becoming vaccinated because it can help prevent you becoming more sick. So to conclude, we will be back with the next segment shortly. Thank you.
Unlike some folks who have to live in the West End, I chose to live in the West End. The reason that I got involved with CAB is because I love my community.
As someone who majored in public health, I see the importance of vaccines. I know for a lot of people, they think public health is just healthcare, but it's actually involving the community.
I think the main thing is education. There's a lot of misconceptions. There's a lot of conspiracy theories. Also, you have a lot of people in this community who don't have a relationship with their healthcare professional.
I'm hoping that we can let people know that, your health comes first and that there are people there who care about you and want to fight for your benefit.
Go to the website. We got tons of information for you.
Vaccines, going to the doctor, these things are for their benefit. And I just want to advocate for them to let them know, hey, I'm always on your side. You have someone that's willing to speak out for you if you feel like you don't have anyone in your corner.
My name is Dr. Crystal Narcisse. I specialize in internal medicine and pediatrics at Norton Healthcare. In 2020, with the pandemic, because the hospital was full with patients with COVID, other patients were having delayed treatment because it exceeded our capacity. I never, ever want to go back there. The tides really turned when the COVID vaccine came out. The number of people having to go to the ER, the number of people actually having to be admitted to the hospital, you saw those numbers plummet. I was weary about the COVID vaccine at first, but I said to myself, if I can take a vaccine that'll help me to be able to keep doing my job to help people, I'm willing to do that. I don't take being a doctor lightly. I'm not going to tell you to do something I'm not going to do. I want you to be able to know that I have your best interests at heart. If I make sure that you're healthy, then I'm helping not just you, but generations after you.
Welcome back to those of you who are viewing. We are still here with Conversations with CAB. And I just want to touch a little bit more on some of the vaccinations, especially that the minority community might benefit from receiving.
I would say top of my list is going to be the HPV vaccine. HPV stands for human papillomavirus. It is the only vaccine that helps prevent cancer. Human papillomavirus is one of the most common sexually transmitted infections in America. And so we recommend that children at the age of 9 can start getting vaccinated. Depending on how early you vaccinate, it could either be 2 or 3 shots.
And can both women and men receive this vaccination? Or how do you think that would work when they go to see their primary care provider for this?
That's actually a great question. It affects both men and women. More women are diagnosed because whenever you get a pap smear, that's one of the things we're looking for.
And can you explain some of the signs and symptoms and why the HPV is strongly encouraged with both men and women and not just women? Because I know a lot of times there is a disconnect with men and getting vaccinated, also women as well. But we see with the HPV that a lot of women are more educated on it. So can you kind of explain that a little bit more?
Another excellent question. I think that one of the misconceptions is that if you have a disease, you're going to have symptoms. And that actually is not the case with HPV. Most people have no symptoms. In fact, whenever I have diagnosed HPV in a woman, it is actually incidentally, which means I'm doing a routine check for cervical cancer. We do a check for HPV and they have it. The thing with men is that there is no routine test for a man. And so men can pass it on to women or other partners without actually knowing that they have it. So that's why it's so important to get the vaccine to help prevent getting the actual HPV virus. Another thing about HPV is that there are some strains that causes warts, and there are some strains that actually cause cancer. When we say cancer, we're talking about cancer of the penis, cancer of the cervix, cancer of the throat, and also cancer of the anus.
Thank you very much for that. I just wanted to kind of connect those dots because a lot of people, I feel like in the minority communities, aren't educated on the HPV vaccinations and why they should be getting it. Can you touch a little bit more on another vaccination that you feel like the minority community could benefit from receiving?
I have to talk about the flu shot again. And that's because I was looking up to see the latest set of statistics that we had coming out of Kentucky. And I know it's a little old, but it's from 2017. And believe it or not, it's number 10 in terms of the leading causes of death in Kentucky. So I would say getting the flu vaccine can prevent you from getting the flu and lower the risk of you getting sick with the flu, as well as going to the hospital or even dying from it. So the flu vaccine is very, very high on my list. Of course, the COVID vaccine, I know a lot of people are not wanting to talk about it anymore, but we can see, if you look at the statistics as to when COVID first came out, a lot of people were dying from COVID. But when the vaccine came out, we saw that the amount of people dying actually plummeted quite a bit. So it really has helped a lot of people from preventing them from having to go to the hospital or even dying from COVID.
And that's very important because especially in the Kentucky environment, we struggle a lot with respiratory issues because of the air quality. So vaccinations can help prevent, or like the doctor over here was saying, can help prevent or help you from becoming more sicker. So I kind of want to hone in more on the minority community. Can you explain some of the barriers that they face when it comes, or when we talk about them receiving vaccinations, whether that's economical, physical, or just the lack of healthcare in the environment or area?
Sure. I would say prior to the Affordable Care Act, that was definitely a barrier in terms of access to healthcare. But when the Affordable Care Act came into being, we had a lot more people who were underinsured or had no insurance have become insured. So, for example, getting Medicaid. So when you have Medicaid, your vaccines are 100% covered. So kids, adults, older, younger, there is really no barrier to getting a vaccine. Now, if you don't have insurance, you don't qualify for whatever reason, you can get immunizations through the health department. So if you want to get vaccinated, there are definitely avenues that you can take to get vaccinated. In terms of the biggest barrier for vaccines, I think is lack of education and also trust. The thing is this, if I told you that I could prevent you from getting a disease, let's say cancer, if you gave me $1 million, a lot of people would say, well, you know what, that'll help me to live a longer life. Well, we do have a vaccine that helps prevent you from getting cancer, and that's HPV. And the HPV vaccine has been out for over 10 years. It's been out for quite a bit of time. And if you look at the research as to when the vaccine first came out, it used to be offered between the age of 9 and 26. But because we saw so many benefits of people getting the vaccine, it was expanded to age 45. And so that's just one tool that we use in the healthcare community to help people to stay healthy.
And as you can see, there's a bunch of different options that those of you who may struggle or have barriers, especially financial, there are places that you can go to receive vaccinations. Local stores like Walgreens and CVS, they have options at low cost. As the doctor said, the health department, they offer them, and your doctor, your healthcare doctor may be able to give you a list of more options so that getting vaccinations won't be an issue. So I just wanted to ask you, in your personal, professional opinion, have you had any cases where you've struggled with getting your clients to become vaccinated, or any stories that you can share to help those who are uncomfortable be more comfortable?
I think because we're still, having cases of COVID, that's going to be the top one. And I think the reason why people were very hesitant is because it was rushed. People say that it was rushed. And I think because there were so many people dying, I don't think that anyone in healthcare had a choice but to, try to develop the research and testing in order to get a vaccine out to really help decrease the amount of people that were dying. So that's going to be one. I'll be honest with you, and I've said this before, that when the COVID vaccine came out, I was very hesitant because I said, well, I don't know what's going to do. And so it took me a few months to feel comfortable enough for me to get the vaccine. And so when I got it, I made sure that my children got it and my husband got it. And I'm very, very glad. And I think it's because of my exposure. If I get sick, then that means that I can't take care of my patients. And I take my job very seriously.
And see, as you can see also, there are other people in the community who struggle or have a lack of trust when becoming vaccinated. So we just really want to encourage those of you who have a lack of trust to consider it and become educated on it, because vaccinations can really, really help, especially those around you or family or friends as well. We will be back with another segment. Thank you.
Unlike some folks who have to live in the West End, I chose to live in the West End. The reason that I got involved with CAB is because I love my community.
As someone who majored in public health, I see the importance of vaccines. I know for a lot of people, they think public health is just healthcare, but it's actually involving the community.
I think the main thing is education. There's a lot of misconceptions. There's a lot of conspiracy theories. Also, you have a lot of people in this community who don't have a relationship with their healthcare professional.
I'm hoping that we can let people know that, your health comes first and that there are people there who care about you and want to fight for your benefit.
Go to the website. We got tons of information for you.
Vaccines, going to the doctor, these things are for their benefit. And I just want to advocate for them to let them know, hey, I'm always on your side. You have someone that's willing to speak out for you if you feel like you don't have anyone in your corner.
Well, my name is Israel Smith. I've been doing social work since 2009. I spent 8 years in prison for robbery. After about 2 years, I took a sociology class just to have something to do. So when I got out, I went back to school. Eventually someone said, Israel, maybe we should make you a caseworker. I love helping anybody because I've experienced just about it all. When COVID hit, we couldn't interact with our clients. Honestly, a few times I did go out, take somebody a blanket, take someone some food. The population that I serve, they already felt people seen them as lowest of the low. I see them as people. I was very hesitant to take the vaccine, but I read as much as I could up on it. I would say go get it because I wanted to be able to interact with the people that I serve. That was the reason why I did it.
Welcome back to the viewers who continue to watch Conversation with CAB. I am here with the MD, and I would like to kind of talk about where there's a disconnect between the providers and patients when it comes to getting vaccinated.
I think first thing is first, to be honest, we have to, as providers, treat our patients like we want to be treated. And I think that if you go to a doctor and you're not comfortable, you don't have that rapport, you should just get a new doctor. I know that can sound like harsh to some people, but honestly, patients are coming to me and they're trusting me with their life and with their health. So you have to have a good rapport. And I think because I have a rapport with a lot of my patients, if I tell them, listen, you need to get a certain test done, you need to get a vaccine done, you need to get certain labs done, they know I'm doing it because I have their best interests at heart. So that's going to be the first thing, is making sure you have a primary care provider that you feel most comfortable with.
Yes, and I would like to touch on that. You have to make sure you're comfortable, as she said, because a lot of times when it comes to patient and provider interaction, you have to be intimate with your provider. That just comes with the nature of being in healthcare. So if you're comfortable with your provider and you build that trust, a lot of times it's easier to want to get vaccinated. Would you agree?
Absolutely, absolutely.
So the reason I would like to further discuss vaccinations, on a provider standpoint or healthcare standpoint, what can we do to advocate or educate people or push that to make other people feel comfortable to get vaccinated? Like, what can we do to kind of get it out there?
When patients come in to see me for their physical, their yearly physical, that's one of the things that we ask. We want to make sure that you're up to date with what we call age-appropriate screenings, like if you're female, getting your mammogram done, if you're male, making sure that you get screened for prostate cancer. But another thing that's on the list is immunizations. So there are sometimes I'll say to my patient, listen, I think you need to get the shingles vaccine or get the pneumonia vaccine. And I'll answer their questions. But if they say, you know what, I'm not comfortable, I need to think about it. What I'll do is I'll schedule an appointment for them to come back and see me in a few months, and then we'll talk about it again and see if the person is ready. Not everybody's going to be ready to get a vaccine because I tell them to. So it's just making sure that you do it when you feel comfortable. Another thing is making sure that you have a physician or a provider that actually goes through those questions with you to make sure that you're up to date with all the things that you need in order to be healthy.
And so what would you say the risk of people not getting vaccinated would be on the community as a whole, especially for minority communities?
Excellent question. So when you get vaccinated, it helps not just you as the individual, but also the community. Here's a good example. Everyone's hearing about the measles virus that's been going around the United States. And so the measles, mumps, rubella vaccine is offered at age 12 months, and then you get a second shot between age 4 and 6 years. And the reason why this is so crucial is because measles is very, very contagious, and it actually can be deadly. When I got the measles, mumps, rubella vaccine at 12 months of age, it helped me to not get measles if I was exposed to it. But the other reason why the measles, mumps, rubella vaccine is important is because when all of us get vaccinated, if someone who has measles comes into the community, it's not likely to spread because we've all been vaccinated. So when we're talking about something like the measles, mumps, rubella vaccine, it helps to protect me as the individual as well as the community. So when I get vaccinated, I not only help me, but I also help everyone else around me. And so we have to have that conversation about what benefits me and also what benefits everybody else.
Yes, ma'am. And so vaccinations are very important, as we can explain a little bit more. However, what would you say to those people who have that feeling like, I already have been sick, I've already had the flu, I've already had COVID, pneumonia, measles, I've had whooping cough. Would you still push or stress the importance of vaccinations for those who have already had the sickness and what it does for them who've already been sick?
Absolutely. I think that is so important, even if you've gotten the flu or pneumonia or anything like that, to get vaccinated, because sometimes your immunity can wane. And we've seen that with COVID. And this is what I mean. If you get COVID, we know that your body produces a lot of antibodies to prevent you from actually getting sick with COVID again. But it doesn't last forever. We know it lasts about 3 months or so. And so that's why it's important, if you're eligible for the COVID vaccine or flu vaccine or any vaccine, to go ahead and get it. Another thing is, a lot of people don't live by themselves. So if you get flu in the beginning of the flu season, and then you're exposed to it later on, and you haven't been vaccinated, then people who live with you can also be prone. You yourself might not get sick, but you can actually pass it on to someone else. So it not only helps you as an individual, but it also helps the people that you live with or even work with too.
And would you say that goes for the elderly population as well? Because we saw during COVID and flu season and pneumonia season, the elderly tend to get sicker because of their immune system. So would you kind of speak to the elderly population and how they can benefit from the vaccinations?
Excellent question. I think people have to realize, as you get older, you're not able to fight things as vigorously as you would when you're younger. And also when you're older, you're more likely to have chronic health conditions like heart disease or diabetes or kidney disease or even asthma or COPD. And so the purpose of getting vaccinated when you're elderly is because you're more likely to actually get sick or wind up in the hospital if you get things like the flu or COVID or anything like that. So it's really, really important. In fact, there was an update. The CDC, or Center for Disease Control, just put out an update just a few weeks ago that if you are 65 or older and you've gotten the COVID vaccine, but it's been 4 months since you've gotten that vaccine, that you should actually get a booster. And the reason for that is that the COVID virus incidence rate is actually on the rise. So it's important to get your booster if you meet that category.
And can you explain a little bit for those who are not more in tune with healthcare what a booster is, if it's an actual extension of the vaccination or if it's them getting more of something else? Because I know there's a lot of confusion when we talk about boosters and vaccination. So can you decipher between the two?
Yes, a booster is basically the same vaccine. So a good example of a booster shot is actually the tetanus vaccine, and that's tetanus, diphtheria, and pertussis. So the last time you get it in childhood is at age 11. And over time, your protection against those different bacteria actually decreases with time. And so you're supposed to get a booster. We recommend you get a booster when you're about 21 years of age, and you get one every 10 years. And so sometimes what we see is children who are not completely vaccinated against pertussis or whooping cough can get it from an adult who hasn't kept up with their vaccines. So that's why it's so important that when you get a vaccine, it not only protects you, but it protects your family and also people in your community.
Thank you for clarifying that, because I know a lot of topics in healthcare may be confusing, or maybe there may be some misconceptions around it, but when it comes to vaccinations and boosters, would you normally say very quickly that it's beneficial more than it is harmful?
Absolutely, 100% yes.
Thank you for those who have watched today. I'm glad to have educated you on vaccinations, the barriers, and why it's important to become vaccinated and receive a booster, especially for those in the minority community. I want to thank Dr. Narcisse for, coming in and sharing some professional insight to help build trust for those of you who may not trust vaccinations. For more resources, please check out westlouisvillecab.com. Thank you and take care.